Hi, welcome to our video about diabetes symptoms in children. How to explain diabetes to a 4-year-old. In a moment, I'll share with you some toddler diabetes stories. Be sure to talk to your child in an age-appropriate way and to always tell the truth. Children who've been diagnosed with diabetes may feel that they've done something to have caused the disease. It's important for parents to make it clear, especially to younger children, that this isn't so. Make sure your child knows that diabetes is not going away and that it's okay to feel sad or upset about having it. Encourage your child to talk about it openly. Also discuss the diabetes diagnosis with your other children who might be jealous of the extra attention their sibling gets or concerned about developing diabetes themselves. The words you use can send a powerful message about diabetes and your child's role in managing it. Be positive. Emphasize that together you can get diabetes under control. Avoid using terms like cheating and being bad if your child veers from the diabetes management plan. Instead, help your child understand how eating and exercise affect blood sugar levels. Children look to their parents for guidance. So how you deal with diabetes can affect how your child talks with you about it. If you overreact about a high blood sugar level, for example, your child might be less than honest with you about future blood sugar readings. It's also hard to expect children with diabetes to limit sugary treats or get regular exercise if siblings and parents don't do the same. Have a family discussion about why living a healthy lifestyle is important for everyone, not just people with diabetes. Include all family members in meal planning and other activities so your child won't feel alone in diabetes management. Preschoolers still rely on parents for their diabetes care. Explain diabetes-related tasks in simple terms. Parents can also help them feel some sense of control by letting the child tell them where they'd prefer to have the insulin injection and which finger to use for a blood glucose test. As children grow, they become more interested in doing things independently and more sensitive about seeming different from their peers. Offer praise whenever your child assumes a new self-care responsibility, and also be understanding of temporary setbacks, which can be especially common when children feel stressed. Avoid being overprotective and reinforce the expectation that children with diabetes can do anything that kids without diabetes can do. Also discuss how having your child take responsibility for diabetes can make it easier to go to fun events like parties and sleepovers. For children of any age, finding a support group can help them connect with other children with diabetes so they'll feel less different. Honest, open communication is key when talking to toddlers and teens about diabetes. The more you talk with and involve your child in diabetes care, the better prepared you'll both be when you're apart. As promised, here are some toddler diabetes stories. Asher was diagnosed with type 1 diabetes when he was just 3.5 years old. His family was in shock. They didn't know what type 1 diabetes was or how to control it. The team at the Diabetes Center at the Children's Hospital taught Asher's family everything they could about the disease and how it is managed. Just 6 months after his diagnosis, Asher was using an insulin pump and his diabetes was under control. Asher's family decided to make sure that their son came first and diabetes came second. They wanted him to have the most normal life possible, so they continued all the usual activities. Now they're just a little more prepared for any surprises that diabetes may throw their way. The whole family participates in local walks, fundraising events and diabetes camps. It's been 4 years since Asher's diagnosis and diabetes doesn't slow him down one bit. He is a happy, healthy 8-year-old living well with his disease. His favorite activity is snowboarding. Yes, you can manage type 1 on the mountain. It is hard for him at times, however, he's learned to stuff supplies in every pocket of his winter gear, so he's always prepared for anything. Right before Chandler's 4-year checkup, his mom and dad noticed that he was drinking a whole lot and always having to go to the bathroom. He would wake up very thirsty and have to go to the bathroom in the middle of the night. The doctor asked Chandler to do a urine test. When the results came back, the doctor told Chandler he probably had diabetes. Tests confirmed that he had type 1 diabetes, which means his body has stopped making enough insulin. Insulin is needed to help glucose get from the blood into the cells. So since glucose can't get into the cells on its own, the amount of glucose in the blood, also called blood sugar, can get very high and cause health problems. To fix this, a person with type 1 diabetes like Chandler has to get insulin through shots or an insulin pump. Chandler says, "I get my blood checked and an insulin shot at breakfast, lunch and dinner, and whenever I want a snack and before I go to bed. It's definitely not fun, but Chandler knows he has to get his shots to stay healthy." Besides testing his blood sugar level and getting shots, a regular day for Chandler is a lot like every other child's. The only big difference is that he always has to pay close attention to his diabetes, as sometimes blood sugar levels can drop down to low. Chandler takes his diabetes bag along when he's away from his parents or school, like over at a friend's house or on a field trip. A diabetes bag usually has everything someone with diabetes might need in case of an emergency. At school, Chandler does his classwork just like everyone else. When it's lunchtime, the school nurse checks his blood sugar levels. The cafeteria team helps him pick out the best lunch choice. Then, after he's finished eating, he goes back to the school nurse for his insulin shot. If you ask Chandler what advice he has to give to other kids with diabetes, he says, "Don't be afraid to try new things. You can still have fun and do things you want to. You just get used to it." In the next video, I'm going to discuss how I can get rid of diabetes permanently.
Please take a moment to subscribe and remember to click the bell icon so you are notified of new content, notifications, and giveaways.
Thanks for watching and have a most outstanding day.